evening, everyone. We begin tonight with a number of deaths related to the H1N1 flu virus continuing in Wisconsin to be on the rise.
The state number now stands at 31. The last count for H1N1 related deaths since spring was 20. The new total does include one death in Oconto County. Fox 11's Becky DeVries takes a look at how you should respond to this latest information.
This was the first H1N1 flu vaccination clinic in Brown County last week. Clinics around the state and country have also drawn crowds.
Very different season from other flu seasons, just in the fact that because it is a novel strain, we are seeing more illness with it.
And with some of that illness comes death. The statewide number of H1N1 related deaths in Wisconsin has risen to 31.
We certainly don't want people to panic. We want to make sure that they continue to take those good precautions, stay home when you're sick, have your little ones stay home when they're sick.
Right now, the H1N1 flu vaccine is for people who are considered high risk. It's for pregnant women, healthcare professionals, and those with chronic sickness.
So the one sort of commonality that we're seeing in many of these deaths and many of the hospitalizations, certainly not all of them, but the majority is that the individuals had underlying medical conditions, which is why you see the vaccine being targeted to those people right now.
And while the number of deaths has increased, state and local health officials report they believe instances of H1N1 may have peaked and numbers appear to be decreasing.
In the last 2 to 3 weeks, our numbers are starting to now trend down, where right now actually in our clinics and in our emergency room, we're pretty much back to normal.
Though the disease may be slowing down, health officials still recommend you take precautions against it and get the vaccine if possible.
Especially with the upcoming holiday season and large gatherings again, we want people to be protected against the infection.
And as far as the number of deaths jumping from 20 to 31, the state health department says that does not necessarily mean 11 people died in Wisconsin during the past week. It means there is new confirmation that those 11 deaths are H1N1 related.